14 Foods to avoid with kidney disease and diabetes. Food is the best medicine for any disease. By following a healthy diet, we can maintain diabetes and kidney diseases under control. But some food items are not suitable if you have kidney disease or diabetes. There are some foods to avoid with kidney disease and diabetes because they cause severe injury to your kidneys in the long term. Before planning a diet, ask your doctor for suggestions for a diet. Still, you don't want to meet your doctor and then try these 15 foods to avoid with kidney disease and diabetes for your diet. Why is diet necessary? Healthy foods can help you to control your blood pressure and blood sugar level. By controlling the blood pressure, you can handle most of the diseases. And these sugar and salt levels are the main reason behind kidney disease and diabetes. The high sodium level in the blood causes kidney failure (CKD) and resulting in taking dialysis or kidney transplantation. Also, a high level of potassium and phosphorus isn't suitable for kidney patients. By avoiding some foods, we can keep our bodies safe while having kidney diseases. Foods to avoid with kidney disease and diabetes. 1. Spinach and Swiss chard. Spinach and Swiss chard are filled with a lot of vitamins and minerals, which never let your health down if you are a non-kidney patient. But the number of oxalates in them may cause some serious injury, and they have a high level of potassium inside it. The amount of magnesium on these is up to 300 mg in a typical bowl of soup. Spinach and Swiss chard are the foods considered healthy but not suitable for kidney patients. 2. Whole wheat bread. Whole wheat bread has an averagely of 50 mg of phosphorus and 60 mg of potassium in 30 grams and a considerable amount of sodium. So take a look at the sodium level before buying the bread. Whole wheat bread was recommended to people because they are full of fiber. If you want bread, then try white bread, whole wheat bread in the list of foods to avoid with kidney disease and diabetes. 3. Dairy products. Dairy products are known for their rich protein level. A cup of milk provides 200 mg of phosphorus and 340 mg of potassium. Too much consumption of dairy products also causes severe damage to the body in the long term. Believe it, if you already have kidney disease, then too much milk consumption will weaken your bones because phosphorus will suck the calcium out from the bones. 4. Bananas. Bananas are fruits with less sodium in them. But a banana can averagely bring 400 mg of potassium to your body. Because of the high potassium level, they are not recommended if you are a kidney patient. 5. Potato and sweet potatoes. Potatoes and sweet potatoes were readily available vegetables, but a normal potato has 610 mg potassium inside it. It's not good news for a kidney patient. The fact about the potato is that if you boil the potato for a certain time, the potassium level is getting lower. Thus you can add potato to your plate if you cook it for a long time. 6. Orange and orange juice. Orange is known for full of vitamin C, but the potassium level in orange is 470 mg, which is high. That's okay for a healthy person but not suitable for a kidney or diabetes patient. So if you want to try some juices, try apple or grapes juice, which is low in potassium levels. 7. Brown rice. Brown rice is another high potassium and phosphorus content food that people with kidney disease should avoid. It has 150 mg of phosphorus and 160 mg of potassium. Pearled barley is an adequate substitution for this brown rice. 8. Meat. When it comes to meat, fresh meat is better than processed meat. Hot dogs, sausages are having a higher level of sodium that's not good for health even for a healthy person. Canned meat is nothing better than that, they also salted and have a high sodium amount inside them. 9. Tomatoes. Hearing tomatoes on this list is bad news for many guys who have tomatoes or its byproducts on their diet food menu. A cup of tomato sauce has a minimum of 900 mg of potassium, making it unsuitable for the renal diet. If you really want to keep your kidneys safe, you must avoid tomatoes. 10. Soda with dark color. These sodas have a mentionable amount of sugar, which is not suitable for diabetes patients, and it has a higher level of phosphorus in it. Unlike the natural phosphorus, this an additive one, and it will turn into salt inside our body. Inside 100 ml of soda, there is 100 milligrams of phosphorus inside it. That makes soda as foods to avoid with kidney disease and diabetes. 11. Fast foods. Without a doubt, fast foods are the primary sodium sources, which is dangerous for the kidney. They're not recommended even for a healthy person. They're salted heavily to stay fresh for a long time, which can bring up to a minimum of 1000 milligrams of sodium within a day. 12. Apricots. Apricots are healthy food items but not suitable for kidney patients. They have a higher amount of potassium, which is up to 420 milligrams in a cup. Avoid apricots in any form, most specifically dried apricots. 13. Pickle. Pickle is another food item you must avoid if you are a kidney patient. The pickling process loads a tremendous amount of salt on these products. As a result, the sodium level on pickles is so high compared to any other food item. A usual pickle holds up to 300 milligrams of sodium inside it. It can cause up to kidney failure condition for a patient. If you are already suffering from kidney failure, you must avoid pickles for eternity. 14. Avocados. Avocados are suitable for a regular diet, which is rich in nutrition and fiber. But for kidney patients, it's not so good because of the high potassium level. A cup of avocados holds an average amount of 720 milligrams of potassium, which is so high compared to most foods. If you are going to try foods to avoid kidney disease and diabetes, you should avoid them. Finally, if you or somebody around you suffering from kidney disease or diabetes, food control is essential for living a healthy life without worrying about these diseases. For your health concern, there are 15 foods to avoid with kidney disease and diabetes we recommend.